Hey, today's morning medicine, I'm going to do two of them because they're basically same Bacillus number 7, Bacillus number 10. They're not very big. Bacillus number 7 has more to it, but the folklore, this is named as it was the seventh non-lactose fermenting type of bacillus, which is tubercular um, virus or yeah. Anyways, observed in the laboratory and is as it did not conform to any of the previously known groups, it was given the number 7. Okay, the keynote for this, the use of this nosode, so it's a nosode taken from the tubercular miasm, which I did bacillinum. Now I'm on and Bacillium testium, which is bacillinum is actually the tubercular disease virus, basically what do I want to say? I'm trying to think of the words for it. Anyways, it's been they've taken the tubercular nosode. They made a tubercular nosode out of the actual virus disease, and then Bacillium testium. They did the same thing, and that's a nosode on the testicles. It's a what they call that thing, a inguinal gland, the glands, mastoid glands, eruptions. Anyways, it's from the testicle, a nodule or whatever on the testicle from tubercular um, disease. And now we're in Bacillus number 7. I'm having a tough time this morning. It's a Monday, I guess. Okay, the keynote is mental and physical fatigue. That's a big one. So, and I'll get into 10 next. Mental and physical fatigue, that's a 3. That's a big keynote. Anybody that's laid out, now gelsemium has that. Then there's a few medicines that you would consider with that. Sensitive to cold, damp air. So they don't like any kind of damp, cold air at all. Tense and tired. So not only they're tense and worn out, but they're very tired, but yet they're very tense, like ready to a lot of anxiety, I would imagine, there in the mind. Flatulence and distension, pain in the liver. So they got a pain in their liver, but they, when they eat in that, they get a lot of flatulence and the stomach is distended from it. Backache, worse, heat. So they don't like heat. Most backaches, people want to put heat on it. This person doesn't want it. They hate cold air, damp cold air, but they want heat for their backache. Fibrous rheumatism. So what is fibrous rheumatism? So rheumatism we think of in the joints. Rheumatism being like an arthritic thing in the joints. This is more in the muscles and tendons and all that, especially the neck and the back. Those are 3s. So tense and tired's a 3, mental physical fatigue's a 3, fibrous rheumatism, especially in the neck and the back, is a 3. They have some pain in the chest, but as you'll see, it's a lot more to do with the heart. Catarrhal deafness, so that just means they're having they got a lot of thick mucus in the ear that's giving them that deafness. Thrombosis of the central retinal vein. So that's in the eyes. So there's a blood clot in the eyes, and that basically can go to the heart. Just like they were saying I don't know if they were saying thrombosis, Trump's ankles were swollen. I don't think they called that thrombosis, but it could end up there, So the veins, they said, are not circulating the blood as much. But that's a sign that thrombosis could set in, a blood clot. Dark, pale, puffy, anginoneurotic edema. Now, this is the face. So the face is dark and pale, puffy. How can it be pale and dark? So there's, it's pale, but it can have dark spots. Puffy and giant, and it's puffy. Angino, that's the heart. Neurotic edema. So that's like nerves and stuff is neurotic. Angina is the heart. Edema is fluid retention. So they're retaining a lot of fluid, and this has to do with the heart. This thrombosis in the eye, this anginoneurotic is got to do a lot with the heart. What's going on there? That swelling. That's why I say the ankles of Trump was swelling, and that can lead to the thrombosis, and that can lead to blood clots. Which is a blood clot traveling to the heart. Pain in vulvae for a female. No leukorrhea with this one. So they have metorrhagia, which is heavy bleeding during periods, and then metorrhagia, that's menorrhagia, which is heavy bleeding, metorrhagia, which is bleeding in between periods. So there's a lot of bleeding going down. They don't have any leukorrhea, and that's probably why, because this woman is always having this bleeding going on. Averse to fat. They don't like fat at all. Fat probably gives them that stomach, that abdomen, that flatulence and distension. So dull headaches, so nothing major there. Myocardial, and this is what I say with the heart, myocardial weakness, which is the muscles, weak muscles. So it's not sending the blood around, which can lead to that thrombosis in the eyes and that puffy angino-neurotic edema in the face. Flying stitches. So they got stitches going on in the heart all over the place. They're flying around. Feeble urinary flow, so they're not urinating as much. Probably why they're having this edema in the face. They're retaining water. Limbs, rheumatism of the wrists. So the wrists are really affected by this, and they have osteoarthritis of the knees, and even rheumatoid arthritis. So they can have bone issues. They can have, the arthritis can affect the tissues in that too. I've never really, I don't remember hearing of a, fibrous rheumatism, so there's a lot of rheumatism with this in the knees and the wrists and the, probably all over the body, but especially the fibrous tissues are aching from it. Bronchitis in the lungs, asthma, tough, sticky mucus. So they got a lot of tough, sticky mucus. Uh, with bronchitis and asthma going on, and it's difficult to raise. Worse at 2 a.m. in the morning, and as you'll notice, when they wake at 2 to 3 a.m. So this problem comes on at 2 a.m., especially all the asthma, bronchitis, all the difficult mucus to raise, and Kali carb. All the Kalis would be, related to this medicine. When you look up some of this lung stuff, you'd see some Kali remedies in there. But Kali carbs really related to this 2 a.m., worse 2 a.m. Male, loss of sex function, premature senility. So any old timer that's being, having senility, you might want to consider Bacillus number 7, neck, stiff neck, cracks like a nut. So their neck is always cracking, and that's got to do with that arthritic stuff going on with in everywhere. Fibrositis in the neck and shoulder, which is, a fibrous, pain basically. Nasal catarrh. So they do have a lot of nasal catarrh going on, which is thick, sticky mucus. Constipation and hemorrhoids with this one. Cracks knuckles. So they like to crack the knuckles all the time. And they have infections in the tips of the fingers, which they usually call that whitlow. But anyways, infections in the tips of the fingers, whether it's always there or whatever. Cracks in the palms and the hands, and circulate eruptions in hands, which is just circular eruptions on the hands. Like I said, wakes 2 to 3 a.m. Belching, a lot of the belching. So when they eat, they get a lot of gas, a lot of flatulence, a lot of belching. So in the stomach, the abdomen gets distended. Excessive perspiration. So they sweat a lot. Tonsillitis and quinsy. Quinsy is just pus with that tonsillitis. So they've got a lot of tonsillitis with pus and all that going on. There's no comments with this one. So there's no, let's see, wait a minute. There might be. Did you comments? Yeah, rheumatoid arthritis, shoulders, elbow, wrist, relaxed fibrous tissue. So there's that rheumatoid stuff going in the fibrous tissue with tendency to formation of rheumatic nodules. So that's why the tissues, there's that rheumatism in the tissues, and they get nodules from it. Like I said, it's really related to bromine, iodine, and particularly the Kali salts, especially Kali carb. Among remedies related to this nosode are many of the iodides. All right, so it has that relation to the bromides. You'll see if you look up any of these symptoms, you'll see the bromides, the iodides, the Kalis, especially Kali carb with it. And like I said, there's a lot of rheumatism, rheumatoid arthritis. Even in the fibrous tissue, they have it, and they get nodules in the skin from this rheumatic situation in the um, fibrous tissue. So a lot of heart stuff. My cardio weakness, along with thrombosis in the eye, a blood clot in the eye, and this puffy neurotic edema in the face. So there's a lot of heart stuff with this one, and especially the lungs, bronchitis, asthma, tough, sticky uh, mucus. So you basically want to consider this medicine with a lot of lung stuff, which most of the Bacilinum, Bacillium testium, and number 7 and number 10, Bacillus number 7 and number 10, these would all have, that tubercular thing usually does affect a lot with the lungs. So there's lungs, heart, and rheumatism type of things going on with this medicine. Okay, Bacillus number 10 I did in red. Let's see what it says about Bacillus number 10. Folklore. This is named, it was the 10th non-lactosing fermenting type of Bacillus observed in the laboratory. So, this is interesting because I don't know what they were given for asthma back then. They don't state it here, but it says allergy to drug given for asthma. So they given, they've been, I don't know what they were given for asthma back then. But anyways, whatever drug they were given for asthma was, people were having an allergic reaction to it. So this Bacillus number 10 was taking care of that asthmatic effect that they were getting from the drugs they were given for asthma. Okay, anxious, overactive, irritable, and depressed. So this one, so you can see it's a little difference. Tense and tired. This one's more anxious, overactive, irritable, and depressed. And I think it relates more to the Bacilinum. Let's see what the mind is for Bacilinum, which is the actual, let's read it. Tubercular nosode from a tubercular sputum. So they're taking the spit and making the nosode out of it. But the mind for this, tactium, sulky, snappish, fretful, irritable. Yeah, irritable and depressed. So yeah, this one relates a little more to the Bacilinum, especially in the mind. Pain in gallbladder. So anybody having that, this one had pain in liver. This one has pain in gallbladder. Uh, Pain left and right iliac fossa. That's the hip bones down there. So they're having that pain in the hips from this Bacillus number 10. And this one just has backache within the fibrous tissue in the neck and back more than. So this seems like it's more the lower part rather than this is more upper part of the back and the neck. The Bacillus number 7. Fat uh, Pedunculus lymphoma, pedunculitis, which is the fat in the belly. They got infection stuffs going on in the fat in the belly. Lymphoma in the lower ribs, which is a fat tumor, like fatty lump, we'll say. It's not a tumor so much. Like I said, and that's why I say Bacilinum had that also, a fat tumor on the chest. This one has it on the lower ribs. But lymphoma is just a fatty tissue, which is what my dog has. He has a fatty uh, tissue, a lymphoma on his chest. I may want to consider one of these, either Bacilinum or Bacillus number 10. Now, how do you ask a dog questions to determine between medicines? You can't. You have to do a lot of observation. Now, and that's the same thing with plants. Homeopathic medicine works with plants. Matter of fact, I got a class this week with agro homeopathy lady who talks about, a lot of things with what they're doing. Like if you want to get rid of bugs that are eating your plants, you would take that bug, make a homeopathic medicine out of it, put it back onto the plants, and that usually will get rid of it. And there's other things, other medicines, homeopathic medicines that would work to deter bugs from eating your plants rather than putting poisons on it, and then you got to eat the poison. So and that's what's so great about homeopathy is you can, like I said, the lady was on a cruise and everybody was getting seasick, and tobacco, which is homeopathic medicine, is great for seasickness. She didn't have her kits with her, so she took I don't think she had tobacco. She might have had a kit, but she took the cigarette from a tobacco from a cigarette, crushed it up, put it in water, pounded it 100 times, dumped that out, put more water in, pounded it 100 times, dumped that out, put more water in, and you could just leave one drop of water in that bottle and refill it and pound it again. Now, I don't know how many times she did it, but then she gave it to the people and the seasickness went away for them. So that's why I say you can take a bug that's destroying your plants, make a homeopathic medicine out of it, give it back, or spray it on the plants in a big, one of them big sprayers, spray it on your plants, and that'll stop that. If you have a disease on your plant, there's homeopathic medicines that would be good for that disease on the plants to overcome that. So same thing with the dog. You can't ask a plant uh, any questions. You can't ask an animal any questions. You have to observe, and that's the real key with homeopathic medicine. Is observing people more than the questioning. The questioning helps to clarify things, but your observation, like that last one was cracks in the hands. You see cracks in the hands. This person's always cracking their knuckles. You might want to consider this Bacillus number 7. Now with Bacillus number 10, I would consider lymphomas on the ribs. Now, I think Bacillinum had lymphomas. Where was it? Glands, chest. I don't see lymphomas, but I think I remember reading I don't know. I don't know if it's related. Colds, throats, coughs. Okay, anyways. So, lymphomas and the fat in the belly, they get infections down in there. No ears, no eyes, no face, but female. Pruritus, vulvae, which is itching of the vulvae. So they got a lot of itching going on there. This one does have leukorrhea, which has fish odor to it, and Bacillinum had the same thing, right? Where's the female? Female Bacillinum, female. Food, no female. I thought that one had it. Anyways, there was one I just did. I could have swore it was Bacillinum. Anyways, leukorrhea has a fishy odor. I just did one that had the same thing. So there's a few medicines that have that fishy odor with the leukorrhea. It's greenish and corrosive. So in other words, it's burning the skin, but it's greenish and corrosive and fishy odor. Flesh on the groin is raw. That's from that corrosive leukorrhea. Dry, cracked. So there's a lot of dryness and crackness with these. Not so much, with this medicine that's related to the dry and crackness of the skin. Urethral caruncle, postmenopausal lesions. Uh, so a carbuncle on their urethra and postmenopausal lesions. So there's a lot of lesions and a lot of skin. A carbuncle is a skin thing. Like almost like a pimple, but it's not a pimple. I'm trying to think of what these carbuncles, how to explain these things, but they're just a bump on the skin that is from infections and things, like that. But they've got lesions after they have their menopause. They'll get lesions on the groin area. Anorexia, good for anorexia, averse to eggs, breads, tomato, tea, and breakfast. So they want to eat breakfast when they wake up, but they don't like tea, tomatoes, bread, and eggs. Probably why they don't like breakfast, because they're always feeding eggs. Craves sweets, chocolates, fried fish, aggravated by fats. Now I know Bacillinum food, appetite poor. That's all it says. Where the heck was the other one that had all this? Anyways, I may be confusing myself because I look up a lot of these medicines and I do them, and then it's in my mind, and I know I've seen this before, unless I'm just thinking of this medicine I did Saturday. I think I did this board Saturday. But they crave sweets. That could help you to determine. These are all for the differentials. So some may crave sweet, some may crave sour, as I always say. Chocolates they like, fried fish they like, and I haven't really heard that before. I think there's one other one that fried fish they like. Aggravated by fats. So that's why these fats, it probably has their, it doesn't say gas in that, but this one is aggravated by fats too, averse to fat. So these both have that similar sort of thing going on there. Okay, headaches in the foreeye, especially over the left eye. So they have this, the headache always settles over the left eye. No heart, but frequent urination. Now, the other one, number 7, was feeble urination. This one has frequent urination. So this one also has the rheumatoid arthritis. So if you were looking up rheumatoid arthritis, you had these two. This would be a great differential. This one, number 10, has frequent urination. Number 7 has feeble urination, urinary flow. So that would help you to differentiate. If you were looking up rheumatoid arthritis, this says left knee, and this says osteoarthritis in the knee. So if you're looking up arthritis, rheumatism of thigh, so the anyways, if you were looking it up, this frequent urination compared to feeble urinary flow would help you to determine. If you ask the person, how's your urine, how are you urinating, and they say it's feeble, you go with number 7. If you'd say it's frequent, they'd say it's frequent, you'd go with Bacillus, number 10. So they have tenderness in the coccyx. Um, anyways, rheumatism of thigh. So the thighs have like a rheumatic pain in them. Tenderness in the coccyx, rheumatoid arthritis in the left knee, so the thigh, the left knee, and paronychia, which is nail infection. So there's that nail infection again. I think I read that. Well, anyways, I'm not going to try to guess where the nail infection I seen. Okay, in the lungs, they have asthma, which this one has asthma also. Cough, worse morning. So this one's worse 2 a.m. So that would help be a differential between them. Sputum is difficult. Yeah, and they have difficult sputum to raise. So you would have worse in the morning compared to worse at 2 a.m. So that would help you be another differential. And that's how what you're doing is you go in and you're looking up these things. You're looking up asthma, and you get a bunch of different remedies. And one is worse at 2 a.m. at night that wakes them up, and the other one is worse in the morning. You would consider, that would help you to choose between the two medicines when you're looking up the asthma. No male for this one. Mouth. Yeah, mouth is spongy gums. Mercury, you would think of spongy gums. The gums are just spongy, and they have basically a lot of uh, it doesn't say so much teeth. It isn't the teeth so much as, and that's why I say I got this. I hate to remove this tooth, but it's got that filling in it, and the filling has those fillings they were putting in our mouths back then has mercury in it, and so and eventually that mercury can leak out, and I've got a lot of saliva, overproduction of saliva. That's also a mercury symptom, and this one gum here, the gum right by that tooth gets spongy for some reason. And well, not for some reason, I'm pretty short of mercury. So I may have to just go down and have that tooth removed. You they have another process where they'll drill out all that thing. I don't know what they put in nowadays, but I just almost just remove that tooth. Sputum is, oh, where am I at? Offensive breath. So also mercury has that same thing, offensive breath. So you might be considering, if you're looking up these spongy gums and that, mercury along with Bacillus number 10. Oh, there is some neck. Fatty cysts. And this one has stiff, cracked necks, fibrositis, and neck and shoulder. So almost the same thing. That fibrositis is a fibroid type of thing in the neck. And this has fatty cysts in the neck. So a lot of fatty cysts with these two medicines. Nasal catarrh. So it's thick nasal, and this one has nasal catarrh too. So they both have a lot of mucus in the nose. Bowel motion in the morning. Bowel motion in the morning. So they always have a bowel movement right away in the morning. Bowel motion is sluggish. So it's not, they feel like they got to go, but it's very sluggish and have a hard time going. Pruritus ani, which is persistent itching in the anus. Okay, nausea and vomiting of the stomach. So a lot of nausea and vomiting with this one. And there's no, so it's number 10. There's no comments, I don't think, with this one. No. And there's no, nothing being related with this one. Uh, okay, so that's basically tomorrow's Badiaga, freshwater sponge. So we made a, there's sea sponges, which is spongia. Let me see, spongia. LMNOPQRS, spongia. I know my alphabet, anyways. Spongia. What is spongia? Spagilia. I got a lot of, I look up a lot of stuff, so I got a lot of spongia. There it is. I got a lot of markers in my book. Makes it hard to turn. Roasted sponge. Well, maybe that was, doesn't say whether, but anyways, that's a roasted sponge. So they burnt the sponge and made a medicine out of it. Badiaga. I think it's called Badiaga. Badiaja. Whatever. Freshwater sponge. So they just took a sponge. Badiaja is the Russian name for the river sponge, which is a popular Russian remedy. So that's tomorrow. Yeah, that's tomorrow. Badiaga. That is a freshwater sponge from the river that they made a medicine out of. And like I said, spongia is they roasted a sponge. I don't know if it was a river sponge or a ocean sponge, but they roasted it. They burned it basically, cooked it, and then made a medicine out of it. And that's what they do with what's it called? Carbo veg. Carbo veg is a vegetable. They burn a vegetable and then they make a medicine out of it. So that's where they get carbo veg, which is a great remedy for all kinds of lung stuff and different things like that. But they also carbo animalis is another remedy that they burn an animal uh, hide. I think it is the hide. I don't think it's the whole animal, but they burn it and they make a medicine out of it. So those two, carbo animalis and carbo veg, are very big remedies that are always used for a lot of different situations. Carbo veg, especially for lung stuff, and if someone dies asphyxiated and stuff, carbo veg can bring them back. So not that they're dead and it makes them alive again, but they're in the process of dying. That carbo veg could really revive them from any kind of carbon monoxide poisoning, different things like that. So, anyways, that is morning medicine. You can age, but you don't have to get old.